Donating your breast milk can help other families in need. Are you breastfeeding your baby? That's great. Are you making too much milk? If so, if you produce more milk than your baby needs, then you might be thinking of ways of donating your excess breast milk instead of just dumping it. Donating breast milk can help other families because some moms may even need to supplement because they're not producing enough milk. In this video, we will talk about the benefits of breastfeeding, what is donor breast milk, what is the process and what are ways of donating your breast milk, and why should you do it? Hey, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. Donating breast milk. You're breastfeeding your baby. Well, good job, mom. The American Academy of Pediatrics supports breastfeeding, and the recommendation is exclusive breastfeeding in your baby's first 6 months and to continue on breastfeeding even after solid foods are introduced as long as you and your baby desires, 2 years and beyond. Now, what are the benefits of breastfeeding your baby? Well, it improves your baby's neurologic development, it improves your baby's dental health, and also there are decreased risk of ear infections, diarrhea, respiratory infections, necrotizing enterocolitis, sudden infant death syndrome or SIDS. Also, there is decreased risk of asthma, eczema, type 1 and type 2 diabetes, as well as your baby being overweight and obese. Breastfeeding also has a lot of benefits for you, mom. It decreases excessive menstrual blood loss, decreases the risk for breast, ovarian, endometrial, and thyroid cancer, decreases the risk for hypertension or high blood pressure, and also diabetes and rheumatoid arthritis. Breastfeeding is good for the environment and for society as well. It's always available and free. Also, babies get sick less often, therefore parents miss less work as well. What is donor breast milk? As we know, breast milk is the best nutrition for a newborn. But when a baby is not able to receive the breast milk from his or her mother, a good alternative is a human donor breast milk, which is expressed from another mother. The milk, this donor breast milk, is a good alternative for sick and premature babies. Now, how can parents source donor breast milk? Well, it can be obtained from milk banks, which are usually found in hospitals with neonatal intensive care units, and these are given to sick and premature babies. Another way to source donor breast milk is through informal networks through social media. If you want to donate your breast milk to a milk bank, there are certain eligibility requirements. You, mom, should be in good overall health. You should have breast milk in excess to what your baby needs. Take note, you should never take away milk from your own baby. Also, you should be able to freeze breast milk within 24 to 48 hours of pumping. And if you're taking any medications, these meds should be approved for donors. And you should meet the minimum requirements of the milk bank, and you should not be taking any herbal supplements. You then may be disqualified to donate breast milk if one is being treated for HIV or the human immunodeficiency virus, or HTLV or the human T-cell leukemia virus, or hepatitis B, hepatitis C, or syphilis, or if you have a sexual partner which puts you at risk for HIV, HTLV, hepatitis B, hepatitis C, and syphilis as well. If there is illicit drug use within the past year, if one is smoking, if one is drinking more than the specified alcoholic requirements, and there are certain travel restrictions as well. Now, you might be wondering how to donate breast milk. What ways should you do to prepare in your donation, and why should you do it? But before we go to that, do you have a newborn? Or you're expecting a baby? How much better life can be when things are under your control upon baby's arrival, where you feel confident about breastfeeding your baby, when you know how to soothe a crying fuzzy baby, when you know when to worry and call the doctor, when you can understand your baby's sleep schedule to better take care of baby as well as take care of yourself as well. How much better life can be when you can get the training in the comfort of your own home. I've developed an online training video series known as the 5 Newborn Care Strategies. Do check that out in the description section. What is the process of donating breast milk? First is to locate the milk bank. Do your research, find out if a milk bank close to your area is currently accepting donors, and read their requirements and check if you meet the minimum eligibility requirements. Next step, you apply. Fill out the forms, be as detailed as possible, tell the truth. Do not lie about the meds you're taking or your current health condition. And of course, complete the steps. Some milk banks may require blood tests, submission of medical records, and doing interviews. And the last is to donate to other moms directly. This may be a tedious process, but it is most rewarding because you're helping another mom. Then, how to prepare the breast milk you're going to donate. First is to sterilize the pump parts. Take each pump part separately and wash them with soap and water. Then sterilize the parts once per day and remember to store them to prevent contamination. Then wash your hands before pumping. Remember not to touch anything to prevent cross-contamination. Then transfer them. If you pump into bottles, be careful to transfer them into bags before freezing. And lastly, label and store. Write the date, time, how many ounces you've pumped, and then store them directly in the freezer. Make sure your settings are correct. And ask for help. If you're sick or you need to take any medications, call the milk bank and ask them if it is safe to donate that milk. Why donate your breast milk? Some moms who have premature babies cannot produce enough milk, and it has been shown that breast milk contains antibodies that protects babies against infections and certain diseases, while at the same time helping babies grow. Giving donor breast milk to sick and premature babies can help nourish them. And research has shown that compared to infant formula, donor breast milk reduces the risk of infections, especially the severe gut disorder in premature babies. Hey, if you like this video and you found this helpful, how about you share it to 3 of your friends who might need it? And watch my next video where I teach you about other child health problems.